Boleh gitu ya.
Right, well, welcome everybody. I'm just about to share my screen. Just one moment, please. And then I will introduce myself and everybody. So hopefully you can see my screen now. So my name is Corinne Podger and I'll be one of the speakers today. So we want to welcome you all to this Roche and WAN-IFRA Science in the Newsroom Masterclass, the big health stories for women in Asia Pacific in 2023. And this masterclass is made possible by Roche, the world's leading provider of in vitro diagnostics and a global supplier of transformative, innovative solutions across major disease areas. So as I mentioned, my name is Corinne Podger and I'll be your lead trainer today. My work involves training journalists in digital storytelling and on topics relating to global development, like women's health today. So by the end of today's session, we hope that you'll be able to innovate the way that you're covering women's health issues. This session will cover the major health challenges facing women in the region and develop story ideas and angles to strengthen the range and impact of your coverage. And I'm actually going to be asking you some questions so that you can do a bit of work today to start to think about some of those story ideas and angles. The program will also dive into the inequities in treatment, care and access to healthcare that women face, for news media to be the voice in this era of the COVID pandemic, where the different needs of women in health can be recognised and met. This training will also take a solutions journalism approach to help you develop responses to women's health coverage, the effectiveness and limitations of those responses, and insights and evidence that can support the adoption of best practice across the region. So before I start, a few housekeeping rules to highlight. It would be fantastic if you can switch your camera on or have a photo up so that we can see your lovely faces. This is helpful for me as your trainer to put a face to names and also for fellow participants and our guest speaker. We also encourage you to have an interactive session. So at any time, you can unmute your microphone, or you can also use the little raise hand function. Down the bottom, you'll see the opportunity to raise a hand. And of course, there are several people here from WAN-IFRA who are monitoring the chat box. So you can also put questions or comments in the chat box. When I'm sharing my screen, it's difficult for me to see the chat box. So what I'm going to ask is one of the WAN-IFRA team to just interrupt me and just raise the questions that are coming up. So the first thing I want to talk with you about is major stories and events about women's health in the Asia Pacific in 2023. So that's the first part of this session, and then we'll move on to solutions journalism in about 20 minutes or so. So first things first, why women's health matters. Why is it important for us to do stories about women's health? We know that women and girls face two major health inequities. The first one is around sociocultural discrimination, and this affects the ability for women to have safe and easy access to doctors and health clinics. So they may not necessarily be able to travel on their own without being accompanied, and it may not be safe for them to do so. They may need to ask someone else's permission within the family or the community to visit a doctor, and they may not feel comfortable asking for permission depending upon the type of health issue they are facing. They will have work and family commitments and may also struggle to get access to relevant information. And that's something I think our industry needs to think about more. Who has access not just to information, but how are they accessing that information? Do the women that are in your target audience have access to a smartphone, for example, or not? Do they have access to social media platforms? And if so, which ones, or not? And that helps us think, okay, but we're going to have to reach these audiences and think about how we do that. And then the second challenge is limited availability of relevant healthcare services. So it might not be possible to access at all healthcare for girls. For women, reproductive healthcare, so cancer screening, pregnancy care, child health care, menstrual care, these kinds of services may not be available, even if they are able to access them, and may not face particular problems with discrimination, but just may not have any. And of course, also there's the issue of violence against women, which can make it very challenging to access any kind of external services. So I want to make this an interactive session. And so you will see me starting and stopping my, screen sharing. I'd like you to think about how discrimination and how availability affect your target audience and the kinds of stories that would help those audiences. We will later in this session have a chance to share topics, but I would love some immediate thoughts from you on this particular question. So how does number one, discrimination, and number two, availability, affect your target audience? And how would you help those audiences? Would anyone like to share some thoughts? I'll give you an example while you're thinking about that. Here in Australia, it's a very big island. I live in Australia, and we do have communities, for example, who are very remote. So there's a very active conversation here in Australia about the closure, for example, of maternity health services. So in some parts of Queensland, which is one of the states here, it's actually very difficult for women to give birth within 100 kilometres of where they live, because some of our maternity services and maternity hospitals have closed down. And so that's an example here of a story that I became aware of because it was covered by the ABC, our national broadcaster, just the other day. And it's important that that gets covered so that women in that area know, if they're planning a family, that they may actually need to think, what happens when I'm 37 weeks pregnant if I need to travel? So that's an example here. Would anyone like to share an example of a story that relates to discrimination or accessibility? You can, as someone's just popped into the chat, you can unmute your microphone to share a thought. I'm very good at waiting until someone pipes up, by the way.
Hi, Corinne.
Hey, Hannah.
Good afternoon. Nice to see you. I was just wondering, does it have to be really related to health, since this is our topic? Because off the top of my mind, the accessibility issues that I can think of aren't really related to health. It's more of financial inclusion. Like I did a story on women farmers, especially during the lockdowns, and how it was so difficult for them to pay for their necessities, as well as apply for loans, especially during the pandemic. So there was this bank in a very remote area in Mindanao that offered a system wherein the bank officers went to their areas to assist them with tablets. So it was a good kind of solution in terms of financial inclusion for them. Mm-hmm. So it's not really related to health, though.
But it is, though. No, don't you think, though, access to health often means access to financial means to access health?
Okay, that's true.
Right. And one of the things we'll talk about during this session is off the back of the pandemic, which is still rumbling along, the financial impacts of that on communities in general have disproportionate impacts on women and affect their ability to pay for health services for themselves and their families. And in some communities or some contexts, they are the primary breadwinner. So when you're thinking about, okay, what's a good follow-up angle to a story like that, it might be, and what's a health outcome or a health impact of the economic impacts of the pandemic. Thank you so much for sharing that, Hannah. And I can see in the chat box, Sunny has said, how do we reach women in marginalised communities? What health services do they have access to? And that's a really good starting question, Sunny. And then excellent follow-up, what training is available to female community health workers in remote communities? And how are they supported in terms of resources? When we get to solutions journalism part of this session, you might then think which support programs for community health workers are the most effective and why. And that's a solutions journalism angle on that story. So hopefully this is all starting to knit together, and this will be a good chance for you guys to, one of my favorite words is ideate, which just means come up with ideas. Okay, I shall bounce back into the slides again. Excellent. And let's move on. Ooh, hang on. So, hang on a second. I need to go back up. There we go. No, the other way. That's it. Excellent. Okay, so some of the things I wanted to talk about today is story opportunities in 2023. And I'm going to cover off on three things. The big issues, and I think there are two. And then regional and international conferences. I want to talk a little bit just about tips on covering those kinds of events. And at the end of this session, WAN-IFRA will send you all a list of resources, which will include sources of health news and also some links to some of the conferences that I've come across. Definitely not an exhaustive list, but a good starting point. So the first big issue is the COVID pandemic. It's still very much here, and it's affecting a whole bunch of things. And, you know, I'll start with my own country. The policy here, the national policy is that, you know, we're just kind of learning to live with COVID. And perhaps some of the coverage of some of the challenges relating to that may not be getting as much traction, or people perhaps aren't as willing to publish negative takes on that policy. And I know that's a challenge across the world, really, that governments are asking us to live with COVID, but how are we then covering what that also means for communities who are affected by it? So access to vaccination is still a big challenge. In some communities and countries, we're seeing very high rates of vaccination, not just first and second dose, but third and fourth. Here in Australia, we're starting to roll out fifth doses, but in some countries, it's perhaps 1 or 2 doses. And there's two sides to that, right? So one is access, and the other is a perceived need by individuals to go out and get third or fourth doses. So that's an ongoing story. Also, access to treatment and the ability to go to hospital, access to hospitals. Then there's also the ongoing economic impact. And Hannah, I think this comes back to what you were saying, is that there are finance stories or economic stories that don't have a natural women's health angle, but then when you sort of take the lid off, you think, actually, this community is disproportionately negatively or positively impacted. And I've got a few of these. So one of them is the ongoing impact of reduced work hours. So over the time of lockdown, people are still coming back from that financially, that period of time. They are still coming back from the impact of homeschooling kids. And women were disproportionately impacted by access for state welfare packages. There just weren't as many for women. These resources are, this slide is informed by data from the WHO. And then there are impacts on children. So typically women tend to be the primary person looking after children at home. I think that's a global thing. It then has knock-on effects on women because of the impact on children. So if children have spent a period of time doing homeschooling, they may be struggling to get used to going back to school. We're certainly seeing that in my family. We're seeing, it's just difficult for the children in the family to get used to the idea that you're going back to school. A lot of children around the world have suffered negative impacts on their education outcomes, and that's something to look at as journalists, and then also the impact on mental health for both parents and also children from this bizarre period of time. You know, if you're turning 12 this year, for example, a quarter of your life would be spent on homeschooling, and maybe 2/3 of the time that you remember being alive would be spent on homeschooling, if that makes sense, because you won't really remember the first 4 years of your life, and then a whole chunk of it was spent being educated at home or not being able to access any education because you weren't able to access digital at all. And then there's long COVID. So the research into long COVID suggests that women, for whatever reason, we're still trying to understand what long COVID is. And because we're still early into this period, how long is long? But women appear to be disproportionately affected. It is an issue that appears to cause ongoing and possibly permanent disability. And around 5 to 10% of people who are infected have ongoing health problems. One of the pieces I was reading a few weeks ago on this was that definitions of long COVID are still taking shape. So if you were to say long COVID is, you know, a serious disability, then the proportion is smaller. If you say, well, it also includes, you know, a bit of fatigue and a cough, then it's a bigger group of people. We are seeing the establishment of clinics to address this, but there's often a huge waiting list and they don't exist in all countries and contexts. And so I think it's an important story to begin covering if you're not covering it already, and start to think about what does the shape of that coverage look like over the coming year or two as we begin to learn more about it. So that's a second question for you guys. How is the COVID pandemic affecting your target audience? Thinking about some of these points above or some that I may have missed, and what kinds of stories would that lend it to? So again, I'll just stop the share and I'd be very keen to hear from you. So access, ongoing impact, long COVID. I'd love to hear some thoughts from you guys on the impacts you're seeing and the kinds of stories that might lend it to. While you are ruminating on this, I'm just going to go back up to Purnima. It's talking about stories on maternal health crisis in rural India during the pandemic. Purnima, do you want to talk to your chat in the chat box? You're very welcome to put your mic on if you like. This trend of opting for home births without the help of any trained medical professional is really interesting. I know not everyone's able. Yep,
I have
go
a
ahead.
very weak internet, so I'm not able to turn on my video.
That's okay. It's lovely to hear your voice.
Yeah, I was just sharing my reporting experience during the pandemic COVID-19 lockdown in India. So this is what I had reported on. There were multiple stories from those villages. So I just thought of sharing it with you all.
I think it's a really interesting trend, actually. And then you've also talked about healthcare centres in rural areas lacking basic medical facilities as well as doctors. And that's, I think, often, you know, journalists as a tribe, we often are coming from urban centres, perhaps where connectivity and access is better. And it is just having that moment to think, okay, well, I'm putting all of this online and on social, but also how am I providing information that's useful to people who don't have digital access? It's a really interesting question, particularly as we digitize as an industry. And then we have this chat comment from Sushmita. Sushmita, that's so interesting. Do you want to just speak to that if you're able to put your mic on?
Hello everyone. So I was planning to do a story about this, that how long COVID leads to fatigue, and we already know that chronic fatigue syndrome is not like, it's underdiagnosed, underreported. There's still no cure. There's still no way to diagnose this condition. But what I got stuck is that I couldn't able to find enough testimonies to support this claim that long COVID is somehow leading to more number of CFS cases. And I just hit a dead end. I didn't know how to approach this. I think this can be a good story, but I just don't know how to go about it. So it would be great if you can just guide me a little bit.
Sure. As I understand it, and I have done a bit of reading about this actually, which is lucky, there's not a causal link between long COVID and chronic fatigue syndrome, because chronic fatigue syndrome can be caused by a number of things. But what has been observed is that some of the symptoms of long COVID are very similar to chronic fatigue syndrome. And Sushmita, what you might find useful is to look at perhaps the NHS, the National Health Service website in the UK. So Britain does have long COVID clinics. Britain had a very difficult time with the pandemic, as we know, and has the resources to set up long COVID clinics. And some of the responses to people who have long COVID include using some of the methods that are used to respond to chronic fatigue syndrome. So rather than assuming that one leads to the other because they're different, it's maybe to think, what does the medical profession see as similarities between these two conditions, both of which have, well, we know long COVID comes from COVID, but CFS can come from a variety of things, but also just to pull apart, does that work? What do we know about it, etc. I think also, certainly in the UK, the chronic fatigue syndrome community have found the attention on some of the health challenges that they are experiencing useful as a result of the arrival of long COVID, which is an interesting thing. And I'll just take one more comment here, which is from Rita. Oh, that's just a hello. And then Najua is saying maternal mortality rate in Malaysia shot up in 2021 to 68. That sounds very high. I would want to fact check that. But certainly I think the tendency, as we were hearing from some folks, that perhaps people are more likely to give birth away from a medical facility, unavoidably comes with an increase in maternal mortality if people haven't got access to somebody to help them if they have trouble during giving birth. And interesting adverse impacts of COVID vaccination, in particular forms of vasculitis and relating to state health services. And that'll be a really interesting story to do, Lena, because of course you will get very positive responses perhaps from anti-vax communities to a story like that. And it'll be really important to keep it editorially independent and aligned with the science. Have you thought about that at all? Feel free to put your mic on.
Hi, good afternoon. Yes, I am working on it. I have been guided also by an editor and who has also told me to give it a national and a global context or perspective. Hopefully, I'll be able to do it soon.
Okay. It'd be, when you publish it, feel free to tag me on social. I'd love to read it. Okay, let's go back to the slides. Excellent. And then the next one. So some of the other things that we're seeing, I think, have to do with the economy. So, and this speaks, I guess, to what Hannah was saying about there isn't always an obvious women's health angle, but there is an immediate and important knock-on effect of shifts in the economy on health. So we're seeing inflation and cost of living shifts globally. Also disruptions to supply chains, partly as a result of COVID, the conflict in Ukraine, severe weather impacts that we can attribute perhaps to climate change. So changes in what's available. Just the other week, I went down to my local pharmacy and said, can I get my COVID vaccine? And they said it hasn't shown up yet. And one of the reasons is that we actually have quite a lot of people with COVID at the moment in Australia, which is causing absences at work. We're seeing some things that are positives as well that will positively impact on health of women and also of families in general, of children, which will be as a result of more money, basically. So a return of tourism, recovery of micro enterprises. And so some of the information here is coming from resources from the Asian Development Bank and the Asia Foundation, which are in the resources that WAN-IFRA will send you after this class. Micro enterprises, are often run by women. And so the recovery of that sector is very important for their overall health and the health of their families. Also, the ability of people to travel abroad means an increase in or a return to remittance payments, not just in Asia, but also in the Pacific Islands. So remittances are an extremely important part of the economy in some countries. And so if those payments go back up again, then families can return to more normal spending. There's also country-specific challenges. So in Pakistan, for example, sections of the country are still recovering from the serious floods from last summer. And in Sri Lanka, there are still significant challenges with regard to inflation. So if we put on our business hats, what are some of the economic issues that you are seeing that are affecting or could affect women that would be worth looking into over the coming weeks as we move towards International Women's Day to look for a health angle for women? So just have a think about that. So inflation, supply chains, tourism, etc. What are some of the angles that you might explore there? And I'll stop the sharing for a moment. And I'm scrolling back up. It's great to see so many. I hope you're all taking notes of what's in the chat. Okay, let me go up to here. So Vandana, with regard to impact of climate change on women's health, I mean, there's some fantastic work being done in India on climate change and health generally. Pollution, for example, is one. What I might do actually is add a couple of resources into the document that we sent that will address that specific question. So Jen, don't send that yet. I'll add those after the class. Rita asks, can we do stories on women, especially professional workers who have to juggle between work and family during COVID? Absolutely. We may see a return to some of these waves. So right now it's summer where I am, it's winter where you guys are in the Northern Hemisphere. And so some communities may be returning to homeschooling, which is stressful for women and families. It's also really stressful for teachers. So that's something to think about as a health aspect. The mental health aspect as well is important. Yep, as you say, mental and work burnouts. Marianne is talking here about postpartum care services in Korea for women. It's a private service and quite expensive. Absolutely. And that's not necessarily related to COVID or economies. It's just one of those things. It's just very expensive to access postpartum. That's a really interesting angle, actually. Vandana has shared a link to a story about impact of LPG price rises on women's health in India. So there's a great link there. So folks, make sure that you click on that. Okay, so lots to think about in terms of the big issues. I wanted to talk a little bit about regional and global conferences. I've put some links to some of the big events that I've seen into the document that will be shared with you. If you're not from a science journalism or a health journalism or specialism background, you may not be in the habit of looking for and then kind of trawling through conference websites, but I would encourage you to just have a look around. These sorts of events bring together national experts or international experts. You may find that there are also regional ones. So, you know, a region within a big country like India. So same as in Australia, we would have state level conferences and events, for example. These are also environments where people will not just present research, but they also may launch national guidelines or regional guidelines or explore problems or challenges around policy, government policy, that are useful for you to have a look at. So some of the examples there are worth having a look at, and the links to all of those are in the document that I'll share. Some of them are in Asia and the Pacific, so regional, and some of them are international. So for example, Women's Health 2023 will be held in Vancouver in July in Canada. One of the ones that I saw that I thought was very interesting was that the Asia Pacific Maternal and Child Health Conference in Singapore, which was last week, was where national guidelines on maternal and child health were launched. So have a look at Women's Health Conference Asia Pacific 2023 as a Google search, just to start familiarizing yourself with the sorts of events that are around. Now, one of the things that you may not be used to is covering events like this. So I've covered a few conferences, and I've taught journalists how to cover national and international conferences, both in person and remotely. It is a short masterclass today, so I've summarized some top tips. So first of all, research your conference coverage plan is one thing I would really recommend. So start looking at which topics and sessions would interest your audience. So you're sort of doing your story research, basically, and thinking about the kinds of angles and multimedia that you could get hold of. Text content, but also video content and audio. And of course, if you have a smartphone, then you have a camera and a microphone, and you can start to gather content there. Keep in mind also that the people who are going, including the speakers and so on, they also have smartphones. And so you might ask them to record themselves responding to some questions. Perhaps if you're putting together a podcast, the microphone on a smartphone is good enough. So just a little tip there. Also thinking about interviewees you can contact in advance. The bigger the conference, the harder it is to find critical people. So reaching out to people before you go and saying, are you going to be there? Where are you staying? What's your WhatsApp number? You know, can we arrange to meet? Just so you've got the person's contact number so that you don't miss each other. And then just maybe lining that up before you even get on a plane or a bus or a train to go. And then creating a little calendar for yourself. So what could you do in advance? And we know, of course, it's just February now that International Women's Day is coming up in just about 3 weeks or 2 weeks. So start to think, what is the story that you're going to do for International Women's Day? And if you're covering a conference, what are the sort of stories that you could do in advance that won't get drowned out by the noise of conference coverage when an event is actually on? Perhaps that might include a curtain raiser. What are the big issues that will be discussed at this conference? Then choosing the sessions that you're going to go to. It's always helpful to have a venue map if you're actually going to go there. And what would you like to do in retrospect? What are the key outcomes? What were the guidelines that were launched? What are the policy implications? Starting to think about that. And you'll get all of that from looking at a conference program. And it's going to help you if you think about social content when you're doing your calendar, your content calendar planning, rather than thinking, oh, I've come all the way back and I didn't take any pictures, I didn't film any video, I don't really have anything for Instagram or YouTube or LinkedIn. So just thinking about what you can capture along the way. Does anyone have any questions about that before we go on? Feel free to pop your microphone on or put the questions in the chat box. I will go on to the next slide and then I'll pick up any thoughts around conference coverage at the end of these 2 slides. So the other thing is checking logistics. So if I think a lot of us are out of the habit of traveling. So just the return to, the old things that we had to do of conference registration, thinking about visas and where you're going to stay in advance, making sure you do the registration. Keep in mind that the person that's organising conferences and events may also be out of the habit of organising face-to-face events. So you may find that the organisers are a bit behind the 8 ball as well. And then also checking what's available on site. So is there a press room? Are there quiet rooms for interviews? Those kinds of questions. Will there be press conferences? Will there be a sound deck that I can plug a microphone lead into? All those kinds of logistics questions that will make it easier when you get there. And if you're covering it remotely, you know, what are the Zoom links? Will it be recorded? I think as we go back to face-to-face, there are fewer events that are hybrid. And I don't think hybrid is necessarily being done well by a lot of organisations or events. And so sometimes we have to be proactive about that. So understanding what hybrid means is a good question to ask if you're going to be covering a conference or event. And then also checking in with the media team, what's available with regard to press releases. Do they have multimedia? Have they got any B-roll, any narrative shots that I can use, and so on? So I'm just going to stop the share there and pick up these questions at the bottom. Any tips that I've forgotten or that you'd like to share with regard to covering a conference in person or online? Any thoughts? Hopefully I've covered most of them. How can I, so Vandana is asking a question while we think about conferences. How can I access the latest research on women's health that's going to be published soon to ensure I have an exclusive story? Well, that's such a great question, Vandana. Most science journals and science publications will have a press release list. So for example, you know, the American Psychiatry Journal, Nature, the Lancet, British Medical Journal, most journals, and those are the ones that just come to mind, they will have a press release list. Sometimes you have to submit press accreditation in order to be put on the mailing list for those press releases, and that's how you get hold of those. And you know that those journals will have been peer reviewed, so it's like it will be reliable content, content that's been peer reviewed and properly fact checked by a scientist's peers before it's published. I hope that answers that question. If no one wants to talk about conferences particularly, I will go back to my slide deck. Oh, hi, Leeway. Good to see you. It's important. Do you want to pop your microphone on? Do you want to speak to that?
I'm currently outside, so I will share a little bit my experience covering COP. It's very important to have like a very good person in charge in press, because they keep on sending lots of materials to help us to produce good stories from the conference. Yeah, thank you.
Thank you. And I know you went to a COP in Egypt, which of course is a mammoth conference and a bit terrifying, just getting off the plane in Sharm el-Sheikh and you go, oh, I don't know what I'm doing. So pre-research is really important. And in fact, Leeway, I might just ask you to speak for a minute on the preparation that you did for COP. How did you get ready to cover that?
I tried to reach out whoever from this the government, from the ministries who represent Malaysia delegations, and I will try to talk to them in advance to produce some of the stories before the conference. And then during the conference also, I try to reach out with them and talk about the outcomes of the COP, and maybe I will try to reach out some of the international expertise who's willing to talk to the media.
That's fantastic. Thank you so much. And I think it's such a good point that if you're trying to actually get interviews with policymakers, if you wait until you're there, it's too late. It has to have been done in advance. I think that being said, scientists and researchers are often very excited to talk to a journalist. It may, you know, their journal article might be, it certainly will be a very big deal for them professionally. And so they're quite often very keen to discuss it. What you may need to think about is demonstrating your journalistic rigor to that person, particularly in this era of decreasing trust in journalism. And so when you're reaching out to people, it may be useful to include links to a few of your recent stories. If you have a paywall, then perhaps attach those as PDFs, just so that the person that you're contacting can see, you know, that you're a serious person, that you're from an editorially independent publication, and that they can trust you to represent their research in an accurate and clear way to a target audience. We go back to the slide deck. Okay. All right, so if you haven't put anything into the chat box, now's a good time to start thinking about doing that. And towards the end of this session, I am about to go on to solutions journalism, but right at the very end, we'll check the chat box. So what I'm asking you is one topic on women's health that you might cover this year. Ideally for Women's Day, but of course that's 2 weeks away, so it could be something that you plan to do in 2023. So start thinking about that. Drop those into the chat box as we go. You don't have to give away your amazing magic story. It might just be a topic. I'm going to look at climate and health, or I'm going to look at, I don't know, economics and remittances and health. Who knows? But perhaps just drop something in there would be really great. And we'll have a look at the end of the session. So section 2, understand and apply solutions journalism and best practice as a journalistic approach to covering women's health. Now, I'm hoping that solutions journalism isn't completely new to all of you, but it will be new to some of you. I'm an accredited trainer for the Solutions Journalism Network, so I'll be drawing on some of that content in this section of the class. And I just strongly recommend having a really good fish around on their website. There are just excellent resources to help you upskill. Yeah, and they also are running quite a few events at the moment, noting that there is a lot of interest in this as an approach to covering social challenges, including health. So what is it? Solutions journalism is rigorous, evidence-based reporting on responses to social problems. That's what it is. It typically has 4 qualities. So thinking about something not as a solution, but as a response, what is the response and how does it work? What is the evidence that it's working? One of the things about solutions journalism is to try and give people enough information that they might implement that response in their community or understand why they couldn't. Right? So what are the insights? Why does the response actually work or fail? And what are the limitations? No response is perfect. So what are some of the pros and cons of it? Why is it working in some places and perhaps not others? These are the 4 qualities that a solution story has to have. And without these 4 qualities, it isn't a solutions journalism, and it may be advocacy or it might be just straight news journalism, but it won't be a solution story. So just to dig into these 4 qualities a little bit more, it has to explain a response. It has to present evidence. That can be hard data, or in the absence of that, and we know that data isn't always collected everywhere and may not be collected exhaustively or transparently, then you may need to use anecdotal information, so interviews with people. It has to explain how it works and why it's effective. It has to offer relevant insight. Would it work elsewhere? And explain the limitations. And if it does those 4 things, then it can be seen as a solution story. So limitations help us understand things like context. For example, a solution to plastic waste that works in Scandinavia may not work in Bangladesh. They're different economies, different ways of processing plastic waste in these 2 contexts. What works in one might not work in the other, and vice versa. And then also what's not working or could be improved. What solutions journalism isn't, it's not hero worship. So we need to focus on the response, the solution, and not the person or organisation that's doing it. It is not about theories and ideas. So it has to be on something that's actually being put into practice right now so that you can get evidence about it, right? If it's a theory, there can't be evidence. And it doesn't have to be positive, right? So stories must be rigorous, accurate, and unbiased. So let's ask a question on the screen here. I'm just looking into the chat box for number 1, 2, or 3. An organisation in your city is helping tackle infant mortality by creating a milk bank for nursing mothers. Which one is the solutions angle? Is it number one, a feature about a woman who's donated 700 litres of her own breast milk? Is it number two, a feature looking at how the milk bank works with data about its impact, information about cultural barriers to milk banking? Or is it a story about, is it number three, a story about a researcher studying the value of human milk banks? Which one is it? I'm just going to have a quick look in the chat box to see what you've decided. I've got some twos, number two. It is indeed number two. Exactly. You've completely understood it. Terrific. So number one would be hero worship. And number three is it's a theory. It's not yet in practice. Fantastic. You're well on the way. Some of the ideas for angles, instead of this just happened. So traditional news is if it bleeds, it leads. This is a bad thing. This just happened. You could think instead of comparisons. So which cities or countries have an effective response to a problem? Perhaps it's a change over time. So over a period of time, this place or this community has improved this social problem. How did they do it? Best practice. Who has had interesting or positive results in implementing a response or a solution? Having a look at who benefits. Are the most marginalised benefiting from a particular response? Are rural and remote benefiting? Are women benefiting? These are a good way of thinking about, is it a good solution to investigate and dig into a bit more and look at the evidence and the insights and the limitations? Cost effectiveness. Is this a cheaper way of doing it or a more effective way of doing it for the same amount of money? Policy efficacy. So is there a city or a state or a council that has introduced a policy? How's it working? Is it solving the problem that it was setting out to solve? And what's the evidence for that? Or thinking about something from a justice or fairness angle. Is a response also bringing about a reduction in inequities or inequalities, particularly for perhaps communities that are marginalised, including, again, women? So there are a bunch of different ideas, and there are loads more in the Learning Hub section of the Solutions Journalism Network website. If you want to look at a different organisation working in this space, there is also an organisation based in Denmark, which is called the Constructive Journalism Institute, or Constructive Institute, sorry, and also has excellent resources. So there's lots to choose from. You can also talk to your audience. So after you've done a story, perhaps a hard news story or an investigation looking at a problem, then think, well, okay, what are some of the problems that people would like you to look at? And what are some of the possible solutions that you've seen or you've heard about that we could dig into a bit more? So ask people what's working, but also what challenges would they like you to perhaps investigate through a solutions lens. Now, when you're doing solutions journalism interviews, there are some different questions that you might need to ask in an interview. How does it work? What's the evidence that it's working? Can I talk to people that you at an organisation or as an individual, you believe that they're benefiting? I need to go and talk to some of those people. Can you suggest some people? Have you seen this working elsewhere? If not, why not? What are the barriers to it working elsewhere? And what parts of the problem are not being addressed by your response? That helps you gather information about limitations. And also, what would your critics say? So this is something that steers a solutions journalism story away from being free PR or hero worship, is actually asking people who are putting a response into place to actively interrogate how it would be perceived by critics. So these are some useful questions that you can include in an interview to help you do solution stories better. Now, not every story can be a solution story. you will still need to do breaking news, investigations. There's also the sports section. You're going to have to write about entertainment, but keep an eye out for what's working in your community. Ask interviewees when you're doing stories that are breaking news and so on about responses or thoughts about responses, and then start having a look. Is anyone doing anything about this social problem? Revisit ideas and sources from your problem stories and think, okay, is there a potential response to this? And there is a wonderful resource on the Solutions Journalism Network site, which is called the Solutions Story Tracker. It's useful both for inspiration and also if you do a solution story, you can submit your story to the tracker and have it added there. And so there's a website and story tracker, and in the resources for this session, when you go into the story tracker, let's just make sure that this does what I want it to do. Click. There we go. So what I've done here is I've put in a filter. If I just go down here a little bit, for, it's a bit small, women and health. And you can see that there are 200 results for your search. And what's here is a short description of the story, and then this will take it to the original website. So down the very bottom there, it's prismsreport.org, for example. So you can filter in the story tracker, and right at the very top, you can see submit a story. So you have the option to upload a story for consideration. So hopefully that's helpful. Now, there we go. Some of the examples include, and there are links to all of these on the story tracker. So these are just some examples. Online text. So a great story from Nigeria Health Watch about responses to reducing pregnancy-related deaths. There's TV examples. So this one's from Al Jazeera on reducing prisoner reoffending in the state of Maine in the US. Social multimedia examples. This one was on plastic recycling. There's quite a lot on plastic waste. There's also quite a lot on climate change, and it would be great, actually, if one of the outcomes of this workshop was an increased number of stories being submitted to the story tracker on women's health. So there are some case studies there of social images. So this is a series of cards that were posted by a news outlet called Plastic Soup to Instagram. And then there's also some terrific examples of podcasts. So how do we fix it is just a general podcast about solutions to or responses to social problems. So it's a general solutions journalism podcast. And then here in Australia last year, a podcast was launched called Who's Going to Save Us? And it's about responses to climate change issues. So I feel there are some really nice gaps in the market for solutions related podcasts on women's health. So just maybe that's something to think about in 2023. And last one I wanted to talk about is multimedia animations. So there are a number of grants around these days for solutions journalism storytelling. This one was produced by a news outlet in Poland called Outriders, and they got some funding to produce a really beautiful multimedia animation looking at the response of marginalised communities to COVID. So communities where there weren't necessarily government or NGO resources to assist. This was a multimedia animation about communities doing things for themselves to protect themselves, their families and their communities during lockdown and the worst of the pandemic. All right, folks, I have an exercise here for you to do in the few minutes that we have left. So your editor asks you to write an 800-word story or a 2-minute radio or TV story on what's working to reduce cervical cancer in your country. And I want you to think about where would you go, what kind of sources would you go consult for responses? What's working to reduce cervical cancer in your country? Where would you go for organisations that are responding to that problem? So just take a minute. I'll give you 60 seconds to write down some thoughts about sources. And when I say ready, I want you to put some replies in the chat box. Got about 20 seconds left, and you don't have to have heaps, just 2 or 3 would be plenty. So if you're ready, you could start popping those in the chat box. And we'll all take a look at the chat box in a minute. All right, ready? Please post replies in the chat box. Let's go have a look. Oh, loads. Fantastic. Yes, please do submit stories for consideration. Strongly recommend. Oh, this is great. So Swagata's come up with some ideas on stories, cancer hospitals. Yep. Fantastic. Yep. OB-GYNs, NGOs, cancer survival experiences. Think too about where you would go to ask people about limitations to a response. Sekar says, I would ask a doctor to dig about the risk, for every women nutritionist about recommended food. And then also always think, what's the evidence and what are the limitations? And that, I think, is probably the biggest challenge for journos, is to think, what's the evidence and what are the limitations? NGOs working for the cause, says Riddy. Doctors and patients groups. Yep. Oh, there's loads. Fantastic. Well done, you guys. Now, I had some thoughts on this, which was think tanks, policy experts, innovation networks. I'm actually just going to click all of these open so that they all populate. So academics, also going after data sets. So it may be that there are institutions and organizations that are collecting data on this. And so perhaps you can get access to data. People involved in implementation. So what are they seeing that's working, what's not? People who are experiencing the problem, what's working, what's not? People involved in the problem will often have very different views on what's working and what's not to people who are implementing solutions. And so it's good to get that feedback. Program officers in a foundation, maybe there are rankings, so international figures, etc., community education programs, women's councils, organisations. So there are lots of places you could go. I'm just mindful of the time, but we started a couple of minutes late, so I'm going to be a bit cheeky and take an extra minute, because this is the really tricky one. The big pushback on implementation of solutions storytelling is often because it's hard for editors to see how this is different to free public relations. So you've come up with a great story pitch on cervical cancer screening, and your editor is worried that it's going to be free PR for this cancer screening program. How are you going to avoid advocacy, like arguing for a particular response, or hero worship? This is a slightly more complex question. So how are you going to avoid this being hero worship or advocacy for that particular program? So I'm going to give you a minute, and then I'll ask you to post your replies in the chat. going to stop the share and just take a look at the chat now. So start posting those, and maybe for those of you who's taking the full 60 seconds, you've got about another 10 seconds. So I'll stop sharing and just take a little look. Oh my gosh, there's loads. Fantastic. By not making it the center of the story, talking to people who are passing away or perhaps their families, lack of screening, talk about numbers, focus on the system or the recommendation, not the people, add some data. Vandana says, zoom out and look at the larger trends in cancer screenings. What are the pros and cons of various available programs, including this one? That's great, Vandana. Approaching medical providers and cancer patients. Riddhi says, focus on the problem, not the organisations doing it. Place the work in a larger context of, say, a city or state. Wonderful. Priyamvada says, focus on the women who benefited and bring in diverse views. What's the limitations on policy? Is it equal access? Brilliant. This is great. Fantastic. You guys have nailed this. That's terrific. I really hope that you're able to take just a note of the chat. When the Zoom ends, of course, the chat disappears. So feel free to, copy or just make some notes in there to help think, to spark your ideas for story coverage. This is such an interactive group. It's brilliant. Thank you so much. Okay. And I had some thoughts on it. Doink. There we go. So paint the whole landscape, as Vandana said, zoom out. Try to avoid words like inspiring, wonderful, super, unique. Nothing is unique. Genius or solution. As we heard in the chat box, make it about the approach, not the organisation. Focus on what people are doing, not who they are. Look for unlikely people. So, of course, it's great for these folks, but it's not so great for these folks. Or it's not working for everybody, but it's working really well for this group of people who are actually, it's been traditionally been difficult to, overcome this problem for this group. Using data, as was mentioned, and comparing and contrasting. So there were some great solutions. You guys picked up all of this in the chat box. So I'm really, really pleased about that. It's fantastic. Okay. Does anyone have any questions? I'm going to stop the share for a moment. If you have a question, you're very welcome to pop your microphone on.
Thanks, Corinne. That was a really good exercise. This is Jaya from Internews. The problem is whenever there's a World Cervical Cancer Day or, World Diabetes Day or something, the tendency amongst all of us is to really blow that whole thing up, whip up a storm around it. And of course, the rest of the year, we move on to other issues. So it always seems like a bunch of firecrackers going off all at once, and then there's silence. And it doesn't really help audiences develop a long-term historical understanding of how big the problem is or how they can relate it to their own lives. Be interested in hearing you or anyone else who might have a better way of, how we can communicate around this. Thanks so much.
My thought about this is actually that I think journalism needs to do a solutions journalism story about journalism, if that makes sense. So,
Good answer.
Well, don't you think, Jaya, if you thought about this from so we're creating a problem for the audience by doing it this way, how do we then not create that problem? So, this is completely tangential, but it's relevant, I think. In the lead up to New Year's, one of my favourite children's novels was dramatised by the BBC, and they released one episode every day up until the 31st of December for New Year's. And so you had a choice. You could either listen to it once a day, or you could listen to the whole series on the 31st of December, right? And if we thought about something like diabetes, for instance, rather than doing a flurry of stuff on World Diabetes Days, because we know it's a problem, is instead say, actually, this is an important issue for people that they struggle with all the time. So why not do something that's regular in the lead up to it and then do something that's special around that day, but that's not when you concentrate your coverage. Does that make sense?
Totally does. Thanks.
No worries. It's a bit, you know what it's also a bit like? It's a bit like Advent. You know, in Christianity, they have Advent where you do Lent, right? So for 6 weeks, you're fasting before Lent. So that means that, actual Easter is not the sort of big thing. It's also that there's this 6-week period leading up to it. So I think we just need to think, what's the lead up time and how can we build a sense of momentum around an issue that's not just in that specific day? And there's plenty of examples outside of women's health that might inspire us. Awesome. Listen, I'm mindful of time. I've probably got time for one more comment or thought before I move on, because we've got some great sessions coming up actually within this. Yep. Anyone? No. All right. Last chance of the OK Corral. I'm going back to the deck. And what I'm going to do now is we are very shortly going to come up for coffee, but after the break, we will have a dialogue session with a very distinguished guest speaker, Dr. Tofan Widya Utami, who is a specialist of Gynecology Oncology, to talk about cervical cancer elimination in Indonesia. And what's great about this session is it will be held in Bahasa Indonesian. So if you're an Indonesian-speaking participant, please stay online, or you can log into the same Zoom link if you want to rejoin after the coffee break. Now, for everybody else, we have some things coming up. So first of all, Roche has prepared dedicated sessions on, first of all, women's health in Malaysia and then in Thailand, along the topic of what can be done to provide better care for women. So for those of you who have a specific interest in Malaysia, please take a look in the chat box right now for the contact information of a Roche media person, so that you can book a media interview with Dr. Ng Char Hong. Please forgive my pronunciation if it's not correct. Consultant breast and breast reconstructive surgeon at Sunway Medical Centre in Malaysia. He will share a holistic approach to providing care, including financial security and insurance. So there's contact information in the chat box for a Roche media contact person. And similarly, for those of you interested in Thailand, in the chat box, I think it's probably the same contact person, but maybe different. Jen can let you know. For a session with Assistant Professor Dr. Nunavut Kantatapon, Gynecologic Oncologist at Chulaborn Hospital. He has set aside a specific session on 24th of February, that's this Friday, from 2 till 3 o'clock Bangkok time, to discuss cervical cancer elimination in Thailand. So if you're interested, please email the Roche media contact provided in the chat box. So I hope that makes sense. I just want to personally note we are in very exciting times with regard to shifts in how we screen for cervical cancer. It's very different to when I was a teenager a million years ago. So these are really interesting sessions. If you don't know how this science sector is changing, I really do recommend learning more about it from some of these sessions. So dear friends, we are now about to take a 10-minute coffee break. So right now it's 11 minutes past. So if you could come back at 21 minutes past, that would be fantastic. And thank you so much for your time and attention. Enjoy your break. Well, welcome back, everybody. Selamat pagi, and welcome to the second part of the program. This will be looking at cervical cancer elimination in Indonesia. I'd like to hand over the room to Taif from O2 Consulting, Roche Diagnostic Indonesia's agency partner to kickstart this session in Bahasa Indonesian. Thank you, Taif.
Hello, thank you, Corinne. Hello, everyone. Please
Thank you.
Hello,
Corinne, thank
please.
you.
Hello, Dr. Utami.
Hello, hello.
Yeah, please allow me to conduct these sessions in Bahasa Indonesia.
Yes, please.
Oke. Selamat sore, Dr. Utami. Di sini sebelumnya
Sore.
aku mungkin mewakili Roche Indonesia ya, dari Mbak Dewi juga. Yang Mbak Dewi mungkin ada di room ini juga, tapi karena ada kondisi yang menyebabkan Mbak Dewi mungkin agak sulit untuk handle sesi ini, jadi aku mewakili Mbak Dewi ya. Jadi teman-teman, untuk di sore hari ini di sore hari ini aku ingin memoderasi ya untuk sesi local session ini bersama Dr. Tofan Widya Utami. Dokter, aku boleh confirm panggilannya Dr. Utami atau Dr. Tofan?
Ya, ya. Jadi memang biasa dipanggil Dr. Tofan.
Oke.
Ya.
Siap. Aku nanti mungkin akan menyampaikan dengan sapaan Dr. Tofan ya, Dok.
Ya,
Di sini Dr. Tofan, aku mau info juga teman-teman jurnalis dari Indonesia, dari Jakarta yang sudah bergabung itu kurang lebih ada 10 orang. Nanti mungkin teman-teman dari media, dari jurnalis juga boleh mengaktifkan kamera atau mikrofon jika ada ingin pertanyaan, langsung saja ke Dr. Tofan. Nah, sebelumnya aku juga memperkenalkan bahwa Dr. Tofan ini adalah spesialis kebidanan dan juga kandungan dari Rumah Sakit Bunda Margonda ya, dokter ya, betul ya?
Iya. Tapi kayaknya sudah tidak lagi ya.
Oke, saat ini boleh informasikan, Dok? Dokter saat ini?
Saat ini saya sebagai staf pengajar sekaligus staf medis di Mas Taif. Kemudian jadi kebetulan ya kami pengajar ya, alhamdulillah sampai saat ini saya dipercaya sebagai ketua penjaminan mutu akademik untuk program spesialis obstetri dan ginekologi ya, jadi SP1. Kemudian juga dalam organisasi ya kebetulan kami dari Himpunan Onkologi Gynecology Indonesia, ketuanya ada Dr. Brahmana sebelum Profesor Arjono ya. Jadi saat ini saya dipercaya untuk jadi sekjen HOGI ya. Jadi mungkin ini mengusung bagaimana kita bisa advokasi kepada pemerintah begitu ya.
Siap, Dok. Nah, aku tambahin ya, Dok ya. Nanti mungkin koreksi kalau misalnya aku ada salah dikit. Nah, Dokter
siap.
juga lulus sebagai dokter umum dari Fakultas Kedokteran UI ya, Dok, pada tahun 2000. Kemudian dokter juga melanjutkan pendidikan spesialis kebidanan dan kandungan di program pendidikan dokter spesialis UI di tahun 2016 ya, Dok ya.
Iya.
Oke. Aku juga mungkin sekilas, Dok, dari teman-teman media Indonesia, dari teman-teman media di Jakarta yang sudah bergabung itu ada, aku cek daftarnya dulu ya, Dok ya. Sebentar, ada teman-teman dari kompas.com, Mbak Sekar Langit, kemudian ada Mas Rizky dari merdeka.com, Mbak Elis dari CNN Indonesia, kemudian ada Fajar Ramadhan dari suara.com, ada Mas Gozali dari Great Health, Mbak Susanti juga sama dari Great Health, dan juga ada Mbak Khadijah dari Detik Health, ada Mbak Rospa dari Detik.com, Mbak Maharani dari Parapuan, dan juga ada Mas Dana Kencana dari IDN Times Jawa Tengah. Nah, sore hari ini dokter mungkin akan coba langsung saja memaparkan paparan tentang kondisi kanker serviks ya, Dok, yang dari Indonesia ya, Dok.
Iya.
Nanti mungkin
saya panggil Mas Taif aja, Mas Taif atau Mas Taif?
Mas Taif boleh. Aku juga mengingatkan teman-teman kalau misalnya mau ada pertanyaan ke dokter mungkin boleh langsung saja ya, Dok ya, ditanyakan, atau mungkin lewat kolom chat juga boleh terlebih dahulu.
Ya, senyamannya saja teman-teman wartawan semuanya, teman-teman jurnalis. Jadi saya rasa ini adalah kesempatan yang sangat baik ya untuk kita bersama untuk brainstorming ya, bagaimana kita bisa melakukan suatu upaya bersama ya sesuai dengan kapasitas masing-masing untuk memberikan sumbangsi kepada negara kita ya. Jadi saya langsung saja bagaimana nih Mas Taif ya?
Ya, boleh langsung, Dok.
Langsung aja ya. Jadi saya tadi sudah disampaikan ada minimal 10 teman-teman jurnalis yang hadir di sini. Saya mohon maaf juga tidak bisa menghafal dalam waktu cepat. Tadi ada beberapa dari kompas.com dan beberapa yang lain ya. Mudah-mudahan nanti kita sembari ngobrol juga saling mengenal begitu ya. Jadi sesuai dengan tugas yang diberikan kepada saya. Jadi waktu awal-awal dari Roche ya global juga bagaimana kita bisa men-share kepada teman-teman jurnalis bahwa inilah kenyataan yang harus kita hadapi bersama. Jadi apa sesungguhnya tantangan ya yang kita akan hadapi ya, yang kita akan carikan solusi bersama dalam melakukan suatu upaya pencapaian WHO Triple Intervention pada tahun 2030 dalam upaya melakukan suatu eliminasi kanker serviks di Indonesia ya. Jadi ini adalah beberapa hot issue yang kita akan bahas ya. Jadi mungkin mohon izin Mas Taif, saya agak cepat ya. Mudah-mudahan dalam sesi tanya jawab kita bisa bisa berinteraksi dengan lebih baik karena slide-nya cukup padat merayap ini ya. Jadi bagaimana kita bisa raising awareness ya, kewaspadaan tentang kanker serviks, bahwa kanker serviks itu adalah satu-satunya bentuk cancer yang saat ini preventable dan sangat treatable juga. Jadi sangat bisa dicegah dan bisa disembuhkan ternyata ya. Kemudian bagaimana kita bisa melihat proyek update nasional saat ini kita di mana dalam rangka pencegahan dan penanggulangan kanker serviks ya. Kemudian apa yang sudah kita lakukan sepanjang waktu ini gitu ya. Kemudian apa yang terjadi dalam kepemerintahan ya, rekomendasi dan implementasinya sampai pada peran dari diagnostik untuk pencegahan kanker serviks ini ya. Dan tentunya yang terakhir adalah bagaimana apa yang bisa kita lakukan ke depan untuk mencari solusi yang lebih baik ya untuk kesehatan reproduksi perempuan di Indonesia ya. Jadi ini adalah outline yang akan saya bawakan ya, mungkin secara singkat, secara global ya, apa sesungguhnya yang terjadi di negara-negara dunia dan apa yang sesungguhnya yang kita hadapi, tantangan di kita dan bagaimana kita bisa melihat kondisi saat ini dan apa yang sudah kita lakukan dan tentu summary yang kita bisa lihat ya. Nah ini adalah latar belakang ya, jadi mungkin teman-teman jurnalis semua sudah paham bahwa WHO saat ini sangat gencar dikatakan bahwa kanker serviks saat ini merupakan suatu kanker yang sangat preventable dan treatable ya, sepanjang dia bisa kita lakukan dengan vaksinasi HPV, kemudian deteksi dini dan dilakukan manajemen secara efektif ya. Tentu ini merupakan triple intervention yang harus kita capai bersama ya. Kalau tidak, maka diperkirakan kematian akan mencapai hampir 50% pada tahun 2030. Nah, ini adalah kenyataan teman-teman ya. Jadi memang sepanjang 30 tahun terakhir kita bisa lihat bahwa angka kanker serviks baik global, regional maupun nasional ternyata menunjukkan penurunan memang, tapi ternyata penurunan sangat lamban di seluruh negara di dunia ya. Nah, kalau kita lihat bagaimana terjadi di Indonesia ya. Nah, kita lihat di Indonesia beberapa tulisan sederhana kami untuk menggugah teman-teman ya yang ada di masyarakat umum maupun stakeholder ya, bahwa kita harus bergerak. Apakah Indonesia bisa bebas kanker leher rahim ya? Apakah itu mungkin gitu ya? Kalau kita lihat di sini memang tidak ada satupun intervensi tunggal yang bisa kita lakukan ya untuk mengeliminasi kanker serviks. Ya, jadi memang tiga-tiga ini yang harus kita lakukan, 90, 70, 90 ya. Nanti kita akan elaborate ya apa maksudnya ya. Jadi kalau kita lihat bagaimana posisi Indonesia ya, dari beberapa pertemuan yang kita hadiri secara regional, inilah kenyataan yang kita harus terima secara pahit ya. Jadi secara berturut-turut di tahun 2019 dan 2020 kita adalah juara bertahan dalam insiden nomor 1 dan kematian nomor 2 di antara negara-negara Asia Tenggara ya. Jadi ini memang kenyataan yang kita harus anggap sebagai bencana nasional ya. Nah, ini adalah situasi ketika kita melakukan suatu presentasi di depan WHO, kemudian Southeast Asia Region meeting ya, bahwa kita sampaikan begitu besar tantangan kita yang memang tidak bisa kita cegah, yaitu adalah bahwa Indonesia termasuk salah satu negara besar ya di dunia dan bahkan terbesar negara kepulauan ya. Nah, ini adalah elaborate tadi yang 90, 70, 90, bagaimana kita bisa melakukan upaya triple intervention ini pada tahun 2030, yaitu diantaranya adalah 90% anak perempuan sebelum 15 tahun adalah tervaksinasi, kemudian 70% adalah screening dan prompt treatment, dan 90% untuk coverage terhadap treatment kanker serviks ya. Nah, ini adalah kita lihat bahwa yang dimaksud dengan screening atau deteksi dini adalah bukan yang biasa, tapi merupakan suatu tes yang memiliki akurasi yang sangat tinggi. Nah, ini dia ya, secara garis besar ini adalah summary yang saya berusaha untuk menyusunnya. Kami berusaha untuk mengelaborate apa sesungguhnya yang kita bisa lakukan gitu ya. Jadi kita paham tantangannya yang pertama adalah geografis, ya. Yang kedua adalah big population. Yang ketiga adalah bagaimana kita memahami specific problem terkait dengan cervical cancer ini dan apa sesungguhnya sumber daya yang kita miliki ya. Nah, ini dia jelas ya teman-teman saat ini sudah paham mungkin ya bahwa saat ini kita sudah bukan lagi 34 provinsi tapi 38 provinsi yang tersebar di seluruh Nusantara dengan lebih dari 17.000 pulau yang terpisah dengan samudra. Tentu ini sangat menjadi kendala yang tidak terhindarkan, yang memang menjadi tantangan yang sangat besar. Kemudian kita tahu bahwa Indonesia memiliki populasi sangat besar, dikatakan kita nomor 4 di dunia ya. Ini adalah juga tak terhindarkan walaupun bagaimanapun program keluarga berencana sudah digalakkan silakan, tapi tentu ternyata masih kita lihat masih sangat banyak populasi yang kita miliki ya dengan populasi yang besar pada usia muda ya. Jadi kalau kita lihat di sini bagaimana tantangan yang terjadi, kita lihat kelompok usia reproduksi pada perempuan usia target screening yang ada di dunia saat ini adalah 25 sampai 65 tahun, itu kita bisa lihat sekitar 71 juta teman-teman ya. Jadi ada beberapa hitungan ya, mungkin sekitar 54 juta ya, tapi kalau misalkan kita membatasi usia 30 sampai 50 tahun itu minimal 39 juta atau bahkan sampai 55 juta perempuan harus di screening tiap 5 tahun atau 10 tahun sesuai dengan anjuran WHO. Ini adalah spesifik problem yang kita hadapi teman-teman. Jadi kita lihat kanker serviks itu adalah juara pertama di antara kanker ginekologi ya, kita bisa lihat di sini. Kemudian yang datang adalah stadium yang sudah advance di mana hampir 80% datang dengan stadium yang lanjut ya. Tentu akan menimbulkan mortalitas yang sangat tinggi. Nah, ini bagaimana dengan sumber daya yang kita miliki? Tentu ini bukan tanggung jawab dari himpunan kami yaitu onkologi ginekologi, kami tidak mampu tentunya ya. Kami berusaha untuk menggandeng seluruh stakeholder, seluruh pihak ya, baik NGO maupun bagi pemerintah, bahwa kita hanya berkekuatan sekitar 124 orang di seluruh Indonesia. Dari 34 provinsi yang saat ini menjadi 38 provinsi, kami hanya berada pada 24 provinsi anggota kami, jadi masih ada sekitar lebih dari 10 provinsi yang masih ada anggota HUGI ya. Kalau misalkan memang 38 provinsi berarti memang hampir 14 provinsi yang tidak ada anggota HUGI-nya ya. Jadi kita bisa lihat bahwa di sini kekuatan yang lain adalah himpunan obstetri, ginekologi sosial yang lebih besar daripada jumlah kami ya. Tentu bidan dan perawat lebih banyak. Nah, ini adalah penting kita usahakan bagaimana garda terdepan yang menjadi peran utama dalam mengatasi masalah ini ya. Nah, tentu kita bisa lihat juga distribusi ya. Kalau teman-teman lihat bahwa rumah sakit besar ya banyak sekali tersebar di kota-kota dan pulau-pulau besar ya. Bahkan juga ternyata distribusi alat-alat secara fasilitas juga tidak memadai, dan mungkin ini akan di racing ya. Mungkin kami minta bantuan teman-teman jurnalis bahwa apa sih sesungguhnya membuat biaya kesehatan di Indonesia lebih tinggi dibandingkan negara-negara tetangga kita ya, bahkan dibandingkan negara India luar biasa jauh sekali biaya kesehatan kita. Mungkin bisa kita endorse juga bagaimana kita bisa menurunkan pajak alat kesehatan, pajak obat-obatan yang masuk, atau bagaimana kita bisa minimalisir bahan baku untuk pembuatan obat di Indonesia sehingga kita bisa bersaing dengan negara India yang luar biasa sangat rendah ya. Nah, ini adalah beberapa analisis SWOT, bagaimana kita bisa memahami kekuatan kita, bagaimana kita bisa lihat juga kelemahan kita dan apa kesempatan-kesempatan dan peluang yang kita miliki, dan apa yang sesungguhnya kita bisa hal-hal yang bisa mengancam kita. Ini adalah secara sederhana, nanti mungkin kita bisa diskusikan bersama ya. Nah, ini yang penting ya teman-teman, di mana kita saat ini berada dan apa sesungguhnya aksi-aksi yang sudah kita lakukan ya. Jadi ini mohon izin, jadi beberapa kolaborasi dengan pemerintahan, Kementerian Kesehatan dalam hal ini, bahwa kita tidak bosan-bosan ya menyampaikan bahwa pencegahan pada kanker serviks itu bukan hanya pencegahan dalam arti sederhana ya. Jadi kita mengenal adanya tiga level ya, 3 tingkatan pencegahan, yaitu pencegahan primer, sekunder, dan tersier ya. Jadi tentu bisa dipahami bahwa pencegahan primer adalah yang paling baik ya, kemudian pencegahan sekunder adalah 2 hal yang tidak terpisahkan. Kalau pencegahan tersier dalam arti kita menangani bagaimana kanker serviks yang sudah terdiagnosis, kita berikan terapi ya, kita berusaha untuk meminimalisir morbiditas ataupun komplikasi akibat intervensi terapi kita ya. Tapi itu kondisi yang sudah terlambat tentunya ya. Jadi kita mengharapkan penguatan dalam pencegahan primer, yaitu vaksinasi, awareness, promosi, edukasi, dan deteksi dini dan prompt treatment dari temuan abnormalitas dari screening gitu ya. Nah, ini adalah beberapa gebrakan yang kita sangat appreciate ya dengan pemerintah saat ini. Kita bisa lihat ini adalah KMK, keputusan Menteri Kesehatan yang terbaru tentang perluasan dari Demo Project menuju NIP ya, National Immunization Program. Ini sangat luar biasa, kami sangat apresiasi dengan Bapak Budi Gunadi Sadikin yang saat ini menjadi Bapak Menteri Kesehatan ya, sekaligus menggugurkan KMK sebelumnya, yaitu ini nomor 6779, bahwa dinyatakan bahwa kita akan bergerak lebih cepat untuk NIP ya. Nah, ini adalah beberapa gambaran situasi bagaimana Bapak Menteri sendiri turun untuk melakukan suatu upaya diseminasi bahwa vaksinasi HPV ini adalah sangat penting dalam upaya pencegahan ya. Banyak hoax yang mungkin nanti teman-teman bisa tanyakan yang terkait dengan vaksinasi yang sangat ekstrim, bahwa dikatakan ini salah sasaran dan seterusnya ya. Seharusnya kita bisa luruskan bahwa ini justru adalah suatu hal yang sangat baik, di mana vaksinasi itu adalah sangat baik menimbulkan immunogenicity di saat tidak terpapar oleh agent tersebut ya. Jadi memang cocok pada populasi anak sekolah ya. Ini adalah beberapa journey ya. Jadi perjalanan ketika kita melakukan suatu upaya advokasi ya dari tahun 2016 menuju demonstration program ya dari usulan Profesor Andriono ya. Jadi Ketua HOGI sebelumnya beliau adalah guru saya juga ya sejak tahun 2016 hingga sampai saat ini ya bersama teman-teman dari ITAGI dan seterusnya. Jadi memang kita lihat di sini ada Bali, DKI Jakarta, Daerah Istimewa Yogyakarta, Makassar, Manado dan Sulawesi juga terlibat di demo project pada tahun 2016 sejak 2016 ya. Kalau kita lihat dari evaluasi demo project ini luar biasa ya. Jadi memang cakupan vaksinasi dalam demo project HPV ini adalah sangat baik, bahkan hampir dikatakan 100%. Ada beberapa yang memang tidak dilakukan vaksinasi dengan alasan-alasan yang sangat kuat ya. Ini adalah juga beberapa perjalanan di mana kita bisa melihat mulai dari simposium HPV, kemudian dilakukan advokasi dan sosialisasi di tahun 2016 ya, kemudian juga surveillance penguatan ya, juga dengan Komnas KIPI sampai pada surveillance training KIPI untuk emergency unit government hospital di Jakarta ya, melibatkan 44 puskesmas saat itu. Jadi di sini juga kita bisa lihat sudah berkali-kali kita melakukan press conference ya terkait dengan kebijakan ini ya, BIAS ya, Bulan Imunisasi Anak Sekolah ya, kemudian juga sudah dilakukan deklarasi program pada tanggal 4 Oktober 7 tahun yang lalu ya. Nah ini adalah beberapa gambaran yang mungkin kita bisa renungkan bersama ya teman-teman jurnalis, bahwa ini data dari Kementerian Kesehatan, bahwa kita melihat dari Januari hingga Juli 2022 ya, Januari 2020 hingga Juli 2022, 2,5 tahun lamanya, kita lihat bahwa ternyata cakupan krioterapi sebagai senjata terapi prakanker di mana kita temukan hasil IFA positif itu luar biasa rendah ya. Angka nasional kita hanya 24,5%. Walaupun kita memiliki data sendiri, FCP Female Cancer Program, ya Prof. Laila adalah guru kami juga, itu kita memiliki data 66,24% ya, tapi angka nasional kita kurang dari 25%. Artinya apa? Kita bisa melihat ketika kita mengejar beberapa angka IFA positif atau lesi prakanker positif, ternyata krioterapi tidak mampu untuk melakukan terapi pada seluruh temuan tersebut, sehingga 75% diantaranya kita bisa bayangkan terjadi progres untuk menjadi kanker serviks yang invasif ya. Jadi ini kita bisa lihat estimasi pada tahun 2020 ternyata meningkat ya dari 32.000 menjadi 36.000 di Indonesia ya. Nah inilah kenyataan yang sama-sama kita harus renungkan teman-teman ya, bahwa saat ini kanker serviks masih bertahan sangat jauh jomplang dengan kanker ovarium ya, peringkat pertama di antara kanker ginekologi, namun dibandingkan kanker payudara memang masih kanker payudara memegang nomor 1 ya di Indonesia. Kemudian kita bisa lihat dari data Global Can 2020 ya, Global Cancer Statistic ya, ternyata terjadi peningkatan, bukan hanya penurunan, tapi peningkatan yang cukup lumayan, sekitar 2.200 kasus baru kanker serviks di Indonesia. Dan kita bisa lihat kenyataannya bahwa dulu satu orang per jam meninggal karena kanker serviks di Indonesia, sekarang adalah 2 orang ya, dengan kita lihat betapa memprihatinkan. Dari target WHO yang kita minta 70% adalah ternyata kita hanya 9,35%. Ini adalah data terbaru ya per Desember 2022 teman-teman. Ini bersyukur karena sebelumnya adalah 5,5%, sebelumnya 8,5%, agak peningkatan 1% ya. Nah kalau kita lihat di sini kita bisa lihat ya, dibandingkan kanker payudara memang comparable ya, bisa kita lihat sebanding ya, bahwa total sasaran perempuan usia memang saat ini masih KMK nomor 29 tahun 2017 yang merupakan revisi nomor 34 tahun 2015. Kanker leher rahim kita total sasaran perempuan adalah usia 30 sampai 50 tahun adalah 41.881.000 sekian. Kemudian kita memiliki target 45% pada tahun 2022 ini sekitar 18.846 sekian ya. Kemudian cakupan deteksi dini hanya baru sekitar kurang dari 10% dengan capaian kinerja yang masih sangat rendah ya. Nah ini adalah beberapa gambaran dari 34 provinsi yang belum termasuk 4 provinsi tambahan termasuk Papua Tengah, Papua Barat Daya dan seterusnya ya. Jadi di sini kita bisa lihat angka nasional kita masih 9,30%, di mana kita bisa lihat DKI Jakarta juga masih sekitar 15%, dengan yang tertinggi adalah NTB 34% dan yang terendah adalah Papua sekitar 0,1%. Nah, ini terkait dengan pencegahan tersier dari teman-teman tadi ya, bahwa kita memiliki bisnis ya, artinya urusan kita utamanya adalah kanker stadium lanjut, kanker serviks, di mana radioterapi adalah suatu backbone ya. Jadi merupakan tulang punggung dari kanker serviks. Dikatakan di Indonesia itu memang distribusi radioterapi itu sangat-sangat memprihatinkan. Kita bisa paham bahwa radioterapi itu sangat merupakan cost yang sangat luar biasa tinggi ya. Namun dengan advokasi dari teman-teman dari perkumpulan radioterapi, Prof. Tati juga menyatakan bahwa ini nggak boleh enggak ya. Bapak Menteri menyambut baik bahwa saat ini kita bisa melihat bahwa beberapa ekstensi radiasi disediakan. Kalau kita lihat data sampai tahun 2022, radiation onkologis kita sekitar 138, hampir sama ya dengan onkologi ginekologi expert ya. Sedangkan dulu sempat 117 ya. Jadi mulai meningkat sekitar 19 orang ya. Ya itu luar biasa 21 orang ya. Jadi dibandingkan dengan medical emphasis ya. Jadi artinya kita masih memiliki radioterapi yang masih memang perlu diperluas. Nah, ini adalah kabar gembira dari teman-teman ya. Jadi bahwa Jabodetabek saat ini memang sangat terbatas untuk radioterapi, apalagi brachyterapi yang merupakan backbone dari kanker serviks ya, bahwa di negara-negara maju yang luar biasa kemajuan dari radioterapi, mereka menyatakan bahwa kanker serviks sangat treatable ya, sehingga mereka bisa menyatakan akan eliminasi. Negara pertama yang bisa kita lihat secara confident mendeklarkan bahwa akan terjadi eliminasi, yaitu kurang dari 4/100.000 penderita kanker serviks di negaranya adalah Australia, yang kita bisa lihat sejak 2007 mereka sudah melakukan vaksinasi HPV pada anak perempuan, dan sejak 2013 pada anak laki-laki ya. Kita bisa lihat di sini beberapa center radioterapi Jabodetabek, kita bisa lihat ada 26 yang disediakan sudah siap ya untuk didistribusikan, dan ini perhitungan standarnya juga ini mungkin kita akan bahas nanti detail ya. Ada 22 center saat ini, kita termasuk center yang third center ya. Nah, bagaimana aksi yang kita sudah lakukan ya? Tentu kami dari himpunan ya Persatuan Obstetrik Gynekologi Indonesia ya, ahli ginekologi dan ahli onkologi ginekologi Indonesia bahu membahu untuk menyatakan bahwa ini adalah suatu kebakaran atau bencana nasional. Jadi memang kami sudah sampaikan beberapa usulan yang sangat strategis untuk dilakukan secara akseleratif gitu ya. Jadi ini adalah beberapa usulan sederhana dari kami ya. Bahwa yang pertama harus ada revisi Peraturan Menteri Kesehatan nomor 29 tahun 2017 tentang target usia screening. Nanti kita akan diskusikan mengapa harus diperluas dari usia 30 sampai 50 tahun menjadi 25 sampai 65 tahun. Kemudian yang kedua adalah bagaimana kita bisa mengakselerasi melakukan shortcut atau potong lintas yang sangat-sangat cepat untuk pengesahan PNPK sebagai dasar dari perubahan atau revisi dari PMK ini ya, kanker serviks revisi tahun 2022. Kemudian juga kita lakukan sesuai dengan rekomendasi WHO bahwa tes DNA HPV high risk adalah satu tes yang harus dilakukan Indonesia dengan tentu memperhitungkan cost ya, dan ternyata memang sudah berhasil dengan studi HTA. Terima kasih Prof. Iko sebagai Ketua KPTK yang sudah sangat menyambut baik ini ya. Kemudian memang kita combine-kan dengan IFA sebagai metode screening di Indonesia karena kita dengan berbagai alasan nanti kita akan diskusikan secara detail ya. Kemudian tentu tadi menjawab krioterapi yang hanya sekitar 24% cakupannya, maka dengan adanya bukti evidence secara ilmiah bahwa TCM merupakan zat kimia yang comparable yang dapat dilakukan untuk terapi prekanser untuk menjawab keterbatasan krioterapi yang tidak bisa didistribusikan melalui udara ya. Tentu kita paham banyak terjadi kekosongan di daerah-daerah yang sangat jauh sehingga ini menyebabkan terjadinya cakupan krioterapi yang sangat rendah. Di sini ada tempat TCE ya. Nah, ini surat-surat ini kita sudah kirimkan. Kami sudah kirimkan per tanggal 8 September 2022 yang lalu kepada Bapak Menteri Kesehatan. Yang terakhir juga adalah akselerasi cakupan ya berdasarkan benchmark. Jadi memang beberapa algoritma juga sudah kita lakukan, dan juga tentu nanti teman-teman di sini perannya sangat luar biasa untuk mendiseminasi ini, bahwa tidak hanya 1-2 pihak ya, kita menginginkan adanya semua pihak terlibat, terutama dalam 14 bidang kementerian selain Kementerian Kesehatan yang ikut bertanggung jawab bahwa screening itu di Indonesia adalah dalam tanda kutip diwajibkan bagi seluruh perempuan seperti Peduli Lindungi ya. Jadi COVID ketika pandemi kita banyak sekali pelajaran kita bisa ambil ya, bahwa ternyata dengan kebijakan atau regulasi itu sangat bisa membuat satu pencapaian atau cita-cita mulia kita bisa tercapai begitu ya. Jadi memang kemarin terus terang saya sangat senang sekali dari Direktorat Promosi Kesehatan Promkes dari Mas Danu saat itu mengumpulkan banyak sekali teman-teman dari NGO ya, bahwa peran dari NGO juga sangat penting untuk melakukan upaya sosialisasi, penyebar luasan informasi, edukasi dan komunikasi, termasuk untuk tadi ya bagaimana kita bisa menyatakan satu suara ya sesuai dengan World Cancer Day saat ini, satu suara satu langkah kita untuk mencapai beberapa target eliminasi kanker serviks ini ya. Nah, ini adalah beberapa yang kita pengen lakukan revisi. Teman-teman mungkin nanti bisa kita tanyakan secara detail lagi ya, bahwa kita minta perluasan dari 30 sampai 50 tahun menjadi 25 sampai 65 tahun ya. Mengapa demikian? Mungkin teman-teman bisa mempertanyakan ya, mungkin sudah ada yang berpikir ya bahwa ini adalah dasar kita, bahwa American Cancer Society yang terakhir juga rekomendasinya menyatakan usia 25 sampai 60 tahun adalah target usia screening perempuan. Ini beberapa international guideline. Bagaimana Indonesia, saya rasa ini adalah capaian yang luar biasa dari pemerintah kita, bahwa memang sudah banyak kebijakan tentang cervical cancer prevention and control, yaitu terutama Undang-Undang Nomor 36 tahun 2019, dan juga tentang beberapa regulasi lain, yaitu menyatakan bahwa manajemen pelayanan kesehatan baik preventif, kuratif, dan rehabilitatif dititikberatkan pada deteksi dini ya, dan pengobatan penyakit tidak menular. Nah, ini termasuk yang saya tadi sudah sampaikan, bahwa dari Pandu ya, pelayanan terpadu penyakit tidak menular kita juga masih menyatakan usia 30 sampai 50 tahun. Ini adalah sebenarnya adalah peraturan Menteri Kesehatan yang sudah direvisi dari tahun 2015 dan 2017 ya. Jadi ini memang kita harus revisi, sudah cukup lama ya, sudah 6 tahun. Nah, ini beberapa alasan juga dasar ilmiah ya, mengapa kita harus memperluas. Ini bukan data dari luar negeri, bukan data dari negara tetangga ya, tapi data dari Indonesia. Jadi teman-teman bisa lihat, kalau kita melakukan satu pembatasan sampai 50 tahun, maka bisa kita bayangkan kita akan tetap jadi juara bertahan dalam mortalitas ya, karena kita bisa lihat data di RSM di sini bahwa minimal 45% penderita kanker serviks kita adalah usia 50 tahun ya, sedangkan data sebelumnya juga berdasarkan Female Cancer Program adalah 52,6% ya. Jadi memang ini adalah dasar yang sangat kuat untuk menyatakan revisi peraturan Menteri Kesehatan, dan juga akselerasi. Kenapa kita harus akselerasi? Kalau kita lihat beberapa proses yang kita bisa lalui, ini adalah kita bisa lihat ada minimal 7 proses yang kita harus lalui sebelum penandatanganan atau pengesahan oleh Bapak Menteri Kesehatan. Tentu panduan nasional pelayanan kedokteran di bidang kanker serviks ini merupakan suatu yang harus kita prioritaskan ya. Jadi tidak harus melalui beberapa step tersebut. Ini juga sudah kita layangkan kepada Bapak Menteri Kesehatan ya. Dan ini juga beberapa usulan kita bahwa menyambut rekomendasi WHO, kita harus bergerak bersama ya, tidak boleh kalah dengan negara Thailand, Malaysia, dan negara-negara di Asia Tenggara yang secara notabene GDP mereka lebih rendah gitu ya, seperti Bhutan, Sri Lanka. Mereka sudah bergerak pada HPV DNA test ya, dengan IFA ya, dokumentasi IFA ya. Ini beberapa algoritma yang kita sudah adopt juga. Ini adalah studi HTA yang sudah kita lakukan dengan 4 daerah utama ya. Ada 2 yang kita lakukan usulan kepada KPTK waktu itu. Ini adalah dasar kita, yaitu WHO Guideline tahun 2013 dan 2021. Jadi bahwa IFA itu adalah sangat baik ya. Mungkin teman-teman bisa menanyakan apa itu IFA ya. Adalah suatu tes untuk melihat adanya lesi precancer pada serviks ya. Dan itu sangat murah tapi sangat-sangat baik untuk dijadikan alat screening di Indonesia gitu ya. Kalau kita lihat di sini betapa luar biasanya IFA, ketika kita melakukan suatu primary screening dengan tes HPV yang relatif mahal, ternyata pada temuan positif IFA ini menjadi triase. Ya, triase itu adalah suatu pemeriksaan untuk menentukan bahwa kondisi tersebut memerlukan terapi atau tidak ya. Jadi memang mengapa kita tidak lakukan IFA sejak awal gitu ya, bersama tes HPV yang tidak menambah biaya ya. Ini adalah beberapa dasar juga kenapa kita melakukan pelatihan IFA dengan dokumentasi, dengan apapun gadget yang kita miliki termasuk handphone ya. Ini adalah satu legacy dari WHO bahwa apapun device-nya kita bisa kerjakan tanpa misalkan kita harus memakai kolposcopy yang relatif mahal untuk Indonesia. Ini adalah beberapa dasar kenapa kita tidak pakai pap smear untuk national program kita, bahwa pap smear adalah banyak sekali persyaratannya, sedangkan IFA sangat luar biasa. Ini saya ibaratkan dengan teh botol ya teman-teman, bahwa dimanapun kapanpun kita bisa kerjakan ya, meskipun pasien sedang haid ya, sedang habis hubungan seksual dengan pasangan seksualnya, itu bisa kita kerjakan ya, berbeda ya dengan pap smear. Sehingga dengan begitu IFA sangat praktis, sangat fleksibel, dengan biaya yang sangat rendah, dan juga langsung dapat diketahui hasilnya. Nah, ini adalah suatu prestasi dari kita, dari kami, yaitu Prof. Laila sebagai guru kami ya. Kita menyatakan bahwa IFA di Indonesia itu beda dengan apa yang ada di yang ada di global. Dan telekonsultasi IFA satu mungkin terakhir yang saya bisa sampaikan yang lalu ya, virtual conference dengan Bapak Menteri yang luar biasa, yang kita bisa lihat begitu agresif ya beliau menanggapi segala usulan-usulan yang sangat baik ya. Nah, yang terakhir adalah bagaimana kita memproteksi dan menyatakan penguatan payung hukum kepada penggunaan TCA ini. Kami sudah sampaikan per tanggal 8 September yang lalu, dan ini yang terakhir ya teman-teman, bahwa diperlukannya kolaborasi lintas sektor ya, baik NGO maupun apalagi pemerintahan. Jadi dalam hal ini adalah 13 bidang kementerian selain Kementerian Kesehatan tentunya ya, ada 13 kementerian yang lain ya, termasuk pemberdayaan perempuan ya, perlindungan anak, kemudian komunikasi dan informatika tentunya ya, Kementerian Dalam Negeri, kemudian edukasi, kebudayaan dan teknologi, dan yang lain-lain, Kementerian Sosial, termasuk hukum dan HAM ya, karena bagaimana kita bisa menyatakan itu melanggar HAM atau bagaimana ya. Kalau kita melihat cita-cita kita ketika saya sampaikan juga pada saat pertemuan dengan promosi kesehatan waktu itu, ada yang akan dijadikan satu sehat ya, jadi jadi pengganti peduli lindungi, bahwa di situ akan terakses semua dari upaya preventif, kuratif maupun rehabilitatif, itu akan terpadu menjadi satu ya. Itu sangat luar biasa, kami apresiasi sekali. Dan juga mungkin kita akan tekankan pada reward ya. Ketika seorang perempuan sudah menunjukkan kartu screening, maka dia juga akan mendapatkan privilege atau keistimewaan, misalkan mendapatkan diskon khusus pada produk-produk perawatan kecantikan dan seterusnya gitu ya. Jadi mungkin juga menjadi persyaratan ya, naik pangkat atau misalkan memperpanjang SIM, atau misalkan memperpanjang paspor, atau juga merupakan syarat untuk masuk ke perguruan tinggi dan seterusnya. Juga termasuk vaksinasi HPV untuk anak perempuan yang usia 11-12 tahun, kelas 5 dan 6 SD, jika sudah menunjukkan kartu vaksinasi, maka mungkin mendapatkan diskon pada bookstore atau merchant-merchant yang mendidik yang lainnya begitu ya. Jadi itu cita-cita sederhana saja, tapi mungkin bisa menjadikan satu strategi untuk ke depan nanti ya. Dan lain-lain juga Ministry Kemenpora ya, dan Pan RB dan seterusnya, Menteri Industri ya, kemudian juga kementerian yang terlibat lainnya, mungkin nanti bisa minta pendapat dari teman-teman sekalian, mana saja kementerian yang bisa kita libatkan lagi ya. Mungkin itu saja yang saya bisa sampaikan. Ini waktunya agak berlebih, mohon maaf, 24 menit. Ini adalah yang terakhir yang bisa saya sampaikan, 2 slide terakhir ya, bahwa bukan hanya tanggung jawab Bapak Presiden tentunya ya, bukan hanya tanggung jawab Bapak Menteri Kesehatan tentunya, juga bukan dari Ketua PPPOGI dalam hal ini Prof. Yudi Hidayat dan Sekjennya Dr. Surahman Hakim, atau kami dari HOGI, Prof. Dr. Brahmana sebagai Ketua HOGI dan saya sebagai Sekjen, atau Prof. Iko ya Budi Weko sebagai Ketua KP3, tapi kita bersama ya harus bergerak ya bersama teman-teman jurnalis tentunya sebagai agent of changes ya. Saya rasa ini adalah tantangan kita bersama, bahwa kita bersama bisa melakukan upaya eliminasi kanker serviks di Indonesia. Baik, mungkin itu saja dari saya. Terima kasih banyak atas perhatiannya. Mohon maaf atas hal yang kurang berkenan. Saya tutup. Selamat sore. Wassalamualaikum warahmatullahi wabarakatuh. Saya kembalikan kepada Mas Taib. Mohon maaf agak lewat waktunya Mas Taib, 4 menit.
Oke, terima kasih Dr. Tofan. Tofan, karena waktunya sangat singkat, sedikit, waktunya tinggal sekitar 7 menit. Singkat aja, ada 2 pertanyaan mungkin yang bisa kita akomodir saat ini ya dok ya.
Ya.
Dari Mbak Maharani dari para Puan dan Mbak Zuzu ya dari dari Detik Health. Mungkin biar lebih ada kesinambungan gitu ya, boleh Mbak Maharani mungkin disampaikan langsung Mbak. Boleh turn on kameranya sebentar, sama ada yang mau ditanyakan, monggo Mbak.
Halo Mas, saya nggak nyalain kamera ya.
Boleh nggak apa-apa.
Ya, Dok mau tanya kan tadi bahasanya
siap.
Untuk kanker serviks itu kebanyakan usia 30 sampai 50 tahun. Lalu apakah kanker serviks itu bisa diderita oleh perempuan yang belum pernah berhubungan seksual, atau bahkan anak-anak pun bisa juga mengalami kanker serviks gitu? Terus kalau misalkan mereka juga bisa mengalami itu, apa yang faktor menyebabkan orang-orang ini bisa mengalami kanker serviks dan bagaimana pencegahannya? Terima kasih.
Ya baik, terima kasih Mbak Maharani. Apa langsung dijawab Mas Taib atau bagaimana?
Langsung dijawab aja dok.
Ya, oke, baik, siap. Ya, jadi pertanyaan baik sekali ya. Jadi tadi ditanyakan, mungkin ada hal yang harus saya luruskan ya Mbak Maharani dan teman-teman semuanya. Jadi usia 30 sampai 50 tahun itu sebenarnya bukan usia yang paling banyak diderita oleh kanker serviks ya, oleh penderita kanker serviks usia utama 30 sampai 50 tahun tidak, tapi itu adalah usia target ya, screening atau deteksi dini yang ditentukan oleh keputusan Menteri Kesehatan di Indonesia 30 sampai 50 tahun. Tentu negara-negara yang lain juga memiliki kebijakan yang berbeda-beda ya. Tapi dari beberapa guideline atau benchmark yang kita adopt ya, American Cancer Society melakukan perumusan 25 sampai 65 tahun ya, batasan untuk target usia screening gitu ya. Itu adalah target usia screening. Tentang usia paling banyak terjadinya kanker serviks sebenarnya memang sekitar 40-50 tahun ya. Tadi kita sudah sampaikan di RSM sendiri sebagai rumah sakit tertiary ya, rujukan nasional, kita memiliki data 45% usia di atas 50 tahun ya, 50 tahun ke atas itu 40%, sedangkan data sebelumnya adalah 52,6% ya. Jadi memang usia-usia 40-50 tahunan itu yang paling banyak ya. Nah, apakah bisa diderita oleh anak perempuan tadi atau misalkan pada yang belum pernah melakukan hubungan seksual ya? Ya, jadi memang terkait dengan faktor risiko tentunya ya. Jadi memang kita minta tolong juga dengan teman-teman jurnalis. Memang beberapa faktor risiko yang ditengarai menjadi faktor signifikan terhadap perjalanan atau natural history dari penyakit kanker serviks ini adalah salah satunya adalah multi partner seksual ya. Tapi tentu kita ingin menyingkirkan stigma ini ya, bahwa saat ini kita bergerak semua perempuan berisiko begitu ya. Jadi memang beberapa faktor risiko yang kita tahu adalah misalkan tadi multi partner seksual atau berganti-ganti pasangan ya. Kemudian menikah atau seksual onset pada usia muda di bawah 18 tahun atau di bawah 20 tahun, kemudian imunitas yang sangat tidak baik ya, atau penderita HIV/AIDS ya, atau misalkan kurang antioksidan, nutrisi yang tidak baik, atau bisa juga merokok gitu ya, bahwa dikatakan ketika kita melakukan tadi ya kita memiliki 5 pasangan seksual maka terjadi peningkatan resiko menderita kanker serviks 12 kali lipat ya. Ketika kita merokok dengan tidak merokok adalah 2,7 kali lipat ya. Jadi kalau lihat dari apa yang terjadi secara studi bahwa 99,7% penderita kanker leher rahim itu adalah terkait dengan HPV. HPV itu adalah virus papiloma manusia, human papilloma virus ya, HPV ya. Jadi artinya yang resiko tinggi atau high risk terutama tipe 16 dan 18 jadi 99,7%. Di mana artinya itu adalah seksual transmitted gitu ya. Jadi artinya memang sekitar 0,3% saja memang tidak terkait HPV. Bisa terjadi pada perempuan yang belum melakukan hubungan seksual tapi sangat-sangat rendah. Jadi sekitar 0,3 atau less than 1% gitu ya. Jadi memang kewaspadaan saat ini kita bergerak bahwa setiap perempuan berisiko tanpa memandang bagaimana seksual behaviornya, dan ini juga stigma yang meruntuhkan. Jangan sampai setiap penderita kanker serviks yang menjadi survivor atau penyintas jadi merasa enggan ya untuk tampil di muka umum ya bersama survivor dari kanker yang lain begitu ya. Mudah-mudahan terjawab ya Mbak Maharani ya.
Gimana Mbak Maharani? Aman?
Aman,
Sudah
terima kasih
terjawab?
dok.
Ya, aman-aman ya.
Dok,
Ya.
mungkin dokter ada waktu mungkin 4 menit untuk
Iya,
menjawab satu
iya,
pertanyaan lagi?
Iya, nggak apa-apa.
Satu pertanyaan ya dok ya?
Dengan senang
Ada,
hati ya.
ya, satu pertanyaan dari Mbak Hodijah ya. Dari TikTok. Kan Mbak Hodijah mungkin bisa nyalakan kameranya dan menyampaikan pertanyaannya langsung ke dokter.
Halo, selamat siang. Sore semuanya.
Selamat sore, Mbak Hadijah.
Selamat sore, Dok Widya. Seperti yang aku tadi sudah tulis di chatbox, sebenarnya tadi kan dokter sempat menyebutkan kalau peringkat atau prevalensi kanker serviks di Indonesia itu agak tinggi dibandingkan negara-negara ASEAN lain. Kalau tidak salah itu menduduki peringkat yang kedua. Nah, sebenarnya ada nggak sih dok alasan kenapa jumlah kasus kanker serviks di Indonesia itu masih sangat-sangat tinggi, dan apakah ada data terkait berapa kasus kanker serviks per tahun dan paling banyak tuh di kota apa gitu? Itu sih dok, terima kasih banyak.
Iya, terima kasih banyak Mbak Hadijah, pertanyaan sangat baik ya. Jadi tadi disampaikan yang pertama tadi adalah ini ya penderita terbanyak ya. Kenapa di Indonesia masih jadi juara gitu ya? Kemudian provinsi atau daerah-daerah yang memang masih menjadi kantong-kantong ini ya utama terjadinya kanker serviks ya. Ya, jadi ini memang sudah banyak kita diskusikan secara nasional, regional juga ya, bahwa memang ini utamanya adalah karena rendahnya screening kita ya Mbak Adijah dan teman-teman semuanya. Jadi pilar pertama dan kedua yang harus kita kuatkan ya, pencegahan primer dan sekunder ya, bahwa memang betul ya tadi ya terkait dengan multi partner seksual ya atau seksual behavior ya, tapi itu bukan segalanya ya. Kita tahu, mohon maaf ya, negara-negara di Eropa dengan segala macam seksual behaviornya ya, kemudian juga mohon maaf ya tetangga kita negara Thailand yang terkenal dengan wisata seksnya begitu ya. Tapi mengapa angka kanker serviks kita jauh lebih tinggi dibandingkan negara-negara maju gitu ya? Yang terjadi adalah karena banyak sekali perempuan kita yang tidak pernah dilihat serviksnya ya. Banyak sekali yang tidak di screening gitu. Jadi intinya adalah kita harus mengejar cakupan deteksi dini kita terhadap serviks sehingga tertangkap dalam lesi prakanker ya. Kalau kita lihat bedanya dengan payudara, kenapa masih tinggi juga? Padahal payudara juga organ yang sangat terlihat gitu ya. Itulah kesadaran masyarakat kita, faktor edukasi dan seterusnya sangat menjadi barrier ya, penghalang tercapainya screening deteksi dini ya, sehingga tadi ya Mbak Hadijah sangat rasional sekali ketika kita mengusulkan bahwa ini harus menjadi gerakan nasional. Bagaimana kita bisa merumuskan regulasi bahwa setiap perempuan yang termasuk dalam usia target ya, yang tadinya 30 sampai 50 tahun yang masih dianut saat ini berdasarkan PMK tadi, kita perluas menjadi 25 sampai 65 tahun, itu harus dijadikan kewajiban ya, yang tadi tuh sebagai persyaratan naik pangkat atau persyaratan untuk memperpanjang beberapa kebutuhan hidup ya, misalkan JKN, paspor atau SIM ya, sehingga kita akan mencapai target cakupan screening yang akseleratif luar biasa ya. Sehingga semakin serviks yang dilihat itu semakin banyak, maka kita temukan dalam lesi precancer dan itu 100% treatable. Sangat-sangat 100% bisa sembuh sempurna begitu ya. Jadi itu kenyataannya. Dan kenapa akhirnya jadi kematian kita juga tinggi? Karena tadi datangnya sudah pada stadium lanjut, di mana di RSCM itu hampir 80%, 77,9% datang pada stadium lanjut. Karena tadi dianggapnya mitos ya. Jadi kayak misalkan setelah menopause terjadi perdarahan gitu, dianggapnya itu misalkan ngabisin darah haid segala macam lah. Kita banyak sekali mitos-mitos yang ternyata itu adalah hal-hal yang dianggap kebenaran gitu ya. Ya itu yang pertama. Dan yang kedua adalah tadi yang kedua tadi Mbak Dija saya agak lupa jadinya.
terkait
Oh, daerah ya,
kota
provinsi.
kota di Jakarta ya.
Ya, jadi memang ini yang besar itu adalah Jakarta, Jawa ya, Jawa, Pulau Jawa, Jawa Timur, Jawa Tengah, Jawa Barat ya, termasuk DKI Jakarta ya. Tapi memang terkait dengan NIP National Immunization Program yang lalu, saya juga bingung ya ini siapa yang memutuskan ya, tentu dengan segala macam pertimbangan ya. Jawa Barat itu termasuk provinsi yang cukup tinggi ya menderita kanker serviks. Namun dalam demo project vaksinasi HPV kemarin kok nggak masuk gitu ya, walaupun kami sudah usulkan waktu itu, tapi nggak tahu saya apa pertimbangannya. Tapi itu adalah hal yang harusnya dipertimbangkan ya. Kita bergerak untuk prioritas utama pada daerah-daerah yang tinggi insidennya. Ya kenapa dulu Bali ya cukup tinggi cakupan screeningnya, karena memang beberapa pemuka agama terlibat ya, bahwa dengan kita melakukan upaya deteksi dini terhadap kanker serviks itu termasuk adalah bagian dari taat terhadap agama dengan terhadap Tuhannya ya, sehingga itu memang menjadi gerakan yang luar biasa. Jadi memang sekali lagi kita bergerak bersama dengan segala kapasitas kita lah ya, betul-betul untuk mengejar screening dan cakupan vaksinasi tadi, deteksi dini juga ya, sehingga pencegahan primer sekunder kita akan mencapai 90-70 di tahun 2030 ya. Ya mengutip pendapat atau ya mungkin berseloroh ya Bapak Menteri waktu itu, ketika melihat kita masih di angka 9,35% pada tahun ini ya, 2022 akhir kemarin, kemudian di tahun 2030 kita direkomendasikan atau dihimbau untuk mencapai 7%. Terengah-engah sekali kita ya, masih ada cuma tinggal 8 tahun, efektif 7 tahun ya untuk mengejar ketinggalan sampai 60% itu rasanya malaikat juga nggak bisa ngejar, begitu kata Pak Menteri, kalau kita hanya bergerak dengan cara yang biasa gitu ya. Tentu ini bukan kita melakukan menghina diri sendiri atau seperti apa ya, tidak ya, tapi itu adalah tantangan yang harus kita pikirkan bersama, bahwa bukan masalah malaikat saja tidak bisa, ini kita harus bisa untuk bersama mengejar akselerasi tersebut, tentu dengan upaya-upaya yang tidak biasa tadi ya, dengan regulasi rasanya ya. Baik, mungkin itu Mas Saif ya.
Oke, terima kasih Dr. Tofan penjelasannya. Semoga Mbak Hadijah sudah terjawab ya tadi pertanyaannya. Kalaupun nanti memang masih ada yang perlu ditanyakan, mungkin bisa tanyakan ke aku atau ke tim O2, nanti bisa kita akomodir untuk jawaban lebih lanjut terkait kanker serviks maupun nanti proses screening yang tadi dijelaskan oleh Dr. Tofan, seperti itu.